Hello, everyone. Welcome back to the sixth edition of the Health Show here on Talk Hot Media. I am your host, Kumbasal. Fellow ladies out there, today's show is specifically for you because there is a saying that as a lady, you need to be beautiful inside and outside. Today's show is going to be very educative. That being the case, our topic of discussion is going to be based on vaginal care. With me here today is Miss Ajua Good, a final year nursing student at the University of the Gambia, intern at American Corner, working at GAM Health as a program coordinator. It's a great privilege to have you, Miss Ajua Good, on the Health Show.
Thank you so much, Kumba. And it's Gap Health, by the way.
Oh.
Yeah. Yeah, I worked there as a program coordinator, and I had interned at the American Corner for 2 years.
Okay.
Yeah.
To begin with the discussion, Ajua, when we say vaginal care, what do we need to know as a lady?
What we need to know is that vaginal care means like maintaining a healthy vulva. So what do you mean by the vulva? This is the external genitalia of the woman.
Okay.
So it's like keeping that place out of irritation. Like usually when you have vaginal infections, you have irritations, and then you have like redness, and then maybe there are sores there. So you need to have good practices when it comes to caring for the vagina.
Okay.
Do not douche, like introducing substances into the vagina.
Okay.
And then also maybe prevent yourself from having unsafe sex, and then having multiple partners that can increase your risk to having vaginal infections.
Oh, okay. So just like you mentioned, will you go tell us like what are some of the healthy signs of a healthy vagina?
So when you have a healthy vagina,
Okay.
it means like you have a normal discharge.
Okay.
And this discharge, like the amount of discharge actually varies from a person to person. Some women experiences like tiny discharges, like just a little bit, and some of them like experiences a lot of discharge. And then also the discharge could vary, during our menstrual period.
Okay.
Let's say during your ovulation, you can actually have a lot of discharge. And then this discharge has to be like whitish, like thick whitish.
Okay.
Also, and then it can be cloudy as well. So like when your discharge is unhealthy, maybe it could be like white grayish in color,
Okay.
or maybe like green yellowish, something like that. And also you should be free from itchiness, irritations, and then sores and all of that.
Okay.
Yeah. And then like when you're having sex, you shouldn't experience pain. Sex, you have to enjoy it as a lady. So when you experience pain when having sex, it means there's something happening. There's something wrong, actually.
Exactly.
Yeah.
Just like you mentioned, you just told us about the healthy tips. Can you kindly go into the unhealthy tips?
Unhealthy tips is like it also depends on the type.
Okay.
The type of vaginal infection. Let's say you have like yeast infection. Usually, like when you have the yeast infection, the discharge is usually like thick whitish, and then it has and it looks like a cottage cheese. And when it's caused by the bacterial infection, like bacterial vaginosis, and then you have like a white grayish color as well, and then you can have a foul scent. The same applies to the yeast infection as well. So you have like a foul scent. Let's say you have a healthy vagina. You shouldn't be experiencing an unpleasant scent,
Okay.
and like it has its own unique scent. I'm not saying it smells so fancy, so good. Some people maybe like when they're using some feminine products, it can smell different. But then a woman have to be familiar with their own vaginal scent. So when something is going wrong, you get to know that okay, this is not right. So let's say like trichomonas. That one it can be transmitted through sexual intercourse.
Okay.
Yeah, and then it's caused by a parasite. So usually when you have that, the discharge is usually green yellowish in color.
Okay.
So and then you could also have some unpleasant scent as well, unpleasant smell.
Oh, okay. I heard you explaining about yeast infection, which I believe might be part of the infections. Like, how many infections do we have generally?
We can say like what really causes them. you know, we have different infections. It's like
Like
sexual.
how many vaginal infection do we have? That is what
I wouldn't be able to tell you how many, but I know like sexual transmitted infection is one of
Okay.
the vaginal infections that
Okay.
happens, like gonorrhea, and then like yeast infection, and then bacterial infection. The bacterial and the yeast infection, I mean the bacteria and the yeast are found in the vagina,
Okay.
you know.
So likely they might be the most common infections that ladies face.
Um, in the Gambia, like
Okay.
most of the times, the ones that people experience the most could be like the yeast and then the bacterial infection. And then why is this happening? Because Gambians like to take antibiotics. You have headache, you go ahead and take antibiotic. Why? And then let's say the broad spectrum antibiotic, that includes the tetracycline and the amoxicillin. And I don't know, maybe you might bear me witness. Sometimes you just see someone taking amoxicillin and the person will be like, I'm having headache. And this is it kills bacteria. It's an antibiotic, it kills bacteria. So that includes the good bacteria, which is found in the vagina. So it's like, when it does that, then what are we left with? We're just left with the yeast
Okay.
alone, which it is fungus. And then these two things live in harmony inside the bacteria. So when you kill the other and leave the other one, it's like you're creating harm. So.
Oh, okay. Just like you clearly mentioned about the causes of these infections. Like now, what I want to ask you is how do one do self-examination on yourself?
It's possible, but then I would say people shouldn't limit themselves to doing self vaginal examination.
Okay.
How can you do that? You need a mirror,
Okay.
you know, and you need good lighting. And then the lady, you have to undress yourself. And I would also add this, that before you do vaginal examination, you need to clean your hands. And maybe if you have a sterile glove, you can actually use that. So you sit down and then, you know, bring your legs towards your butt and flex them open, and, you know, use your light and mirror and look at the vulva, look at the clitoris, open the labia minora, the majora. Usually the vagina in there, you see like it's pink and reddish in color, you know.
Okay.
So you have to check for if there's any irritation, if there's any abnormal discharge. You're supposed to see like something like white discharge, you know, something that is normal. So let's say you start seeing something like greenish and yellowish. The vaginal self-examination is going to help you to get to know like what is going wrong. So it becomes like a baseline to reference, like when something is not happening, something that is not going well. So it helps you to know if there's any genital wart, you know, and if there's any soreness, any ulcers. Having ulcers in the vagina is abnormal. So
Okay.
and then some lumps as well.
Okay. And lastly, I want you to give advice to the general public as to how they are supposed to, most especially the ladies, as to how they are supposed to take care of themselves so that they cannot have these infections related to vagina.
I would like to bring up a scenario. I had traveled few months ago to Kalaji, and I did an assessment in one of their communities. And I can remember like most of the ladies talking about using some substances to do something like, is it taba or something. So some people actually use soap in there to clean it. The vagina, anyone that owns a vagina, I would say you're very lucky, because you don't need too much, you don't need to put in too much effort to clean that place. It cleans itself. So if you're using other substances, some feminine products to clean it, so it's like you're making the balance of the bacteria is gonna throw off. So yeah, you're causing more harm than good, and it's like you're changing the vaginal pH, which is not right as well. And also, like I said, practice safe sex. Use condom, some protective measures, so that you don't get to, like the trichomonas, it can be transmitted through sexual intercourse. So use condom, or maybe you can just stick to one person. I think that is best to do. Okay. Yeah. And yeah.
Well, I think that's a good advice, and I think the viewers will make a very good use of what you just mentioned. Viewers, I also believe that as a lady, like, beauty does not lie on only your face, but also how you take care of yourself. And I think that is very important. With the advice that you gave, I think people will make best use of them and to help themselves in their daily routine life. Well, viewers, this is what we have for you on today's edition. Thanks for watching.
A lot of people are scared of coming to the hospital.
Lee Hunt once said that the groundwork of all happiness is good health. Health is an important part of our livelihood. With good health, man is capable of doing anything. I am Kumbaso. Please join me on Talk Hot Media to set light on our health problems and find solutions to them. This show will explore our health problems in our society and also presenting specialists who have wide knowledge about health to help and direct you through the course of this show, so you can afford to miss this educative show because your health should be your utmost priority. Kindly like and subscribe to our YouTube channel, and please do not forget to follow us on Facebook and Instagram. Thank you.